Today, I'm going to explain the complete process of a hysterectomy in plain language. This is a common gynecological surgery, and doctors will fully evaluate the patient's physical condition before the operation. Simply put, a hysterectomy is commonly used to treat uterine fibroids, severe uterine bleeding, or gynecological tumors. Before the surgery starts, the patient is first positioned in a specific way. This makes it easier for the doctor to operate and clearly see the surgical area, which is a basic preparation to ensure the smooth progress of the surgery. Once the patient's position is fixed, the doctor first makes a circular incision around the cervix, avoiding major blood vessels and nerves. Then, following this incision, the doctor cuts into areas such as the vesicovaginal pouch, using forceps to assist with the cutting. At the same time, the uterosacral ligaments are ligated to prevent bleeding. After handling the ligaments, the Alexis retractor is used for the operation. The inner ring is placed around the cervix and inserted into the peritoneal cavity, and the outer ring is rotated until the desired traction is achieved to spread the tissues apart, facilitating subsequent operations. Once the retractor is secured, the doctor uses their fingers to clean the surgical area and checks for any tissue residue between the inner and outer rings and on the peritoneum. This can avoid affecting the surgical process or causing postoperative infection. After cleaning, the lever on the retractor is closed to secure the gel-sealed cap, and then an inflation tube is connected to further fix the surgical area, preventing tissue debris or blood from contaminating other parts. Next, the patient is adjusted to the Trendelenburg position, which is a posture where the head is lower than the feet. Gravity will pull the abdominal organs downward, creating more operating space. Then, tissue is gradually removed from the bottom until the uterus is completely separated, and the doctor will continuously observe the bleeding situation during this process. Once the uterus is completely separated, the lever on the sealed cap is released to remove the cap, and the uterus is taken out through the vagina. Then, the outer ring of the retractor is rolled outward until it loosens, and finally, the doctor grabs the string and pulls out the retractor, completing the core resection operation. Finally, the vaginal incision is sutured with absorbable sutures. These sutures do not need to be removed later, which can reduce the patient's pain and also lower the risk of infection. The above is the complete process of a hysterectomy. The core is to accurately remove the uterus while taking measures to stop bleeding and prevent infection. After the surgery, the patient should rest well, avoid strenuous exercise in the short term, and keep the surgical area clean.